Thank you, everybody, for tuning in here tonight to the first masterclass of the year. In this masterclass series, we want to take a deep dive into your Verizon retirement benefits and the planning considerations that are unique to Verizon employees and their family members as they plan for retirement. My name is Bobby. This is Bernie. We're from Hapanowicz Associates, and H&A has been helping Verizon employees with their retirement planning for over 20 years. And we have a great topic for you here today. It's a topic that we've gotten a lot of questions about here recently, and that's related to your Verizon Retiree healthcare benefits. And of course, there's a lot of complexities, a lot of nuances and moving parts associated with those healthcare benefits. So today, we hope to simplify those benefits, hopefully in a more digestible form, that will help you make good decisions around your retiree healthcare benefits as it relates to your broader retirement planning. So before we get into that, a couple of housekeeping items before we get started. First, we'd like to point out that we are not affiliated with Verizon in any way. We think that's a good thing because that allows us to provide advice to you and your families, not just now while you're employed at Verizon, but when you're retired as well. And one more thing we wanted to point out, with the nature of this webinar, we are going to be discussing some of the details of your union negotiated contract and your new union negotiated healthcare benefits. And so the details that we discuss here today will be related specifically to Mid-Atlantic CWA Associates healthcare benefits, retiree healthcare benefits. We're aware that there's many people here on the presentation today, on the webinar today, tuning in from across the country. You'll have many overlapping benefits, and more importantly, the planning considerations that we discussed today that will help you make decisions around your retiree healthcare will be universal regardless of where you're tuning in from today. One last thing, we'd like to make sure that everybody is aware of the Retirement Red Zone. This is a feature that we have available to you on our website, and it's meant to help you engage with your retirement planning regardless of what stage of your planning you're in, whether you're 10 years away, 2 years away from retirement, or already retired. There are going to be a lot of very helpful resources there at the Retirement Red Zone for you to check out. So I'll turn it over to Bernie. Bernie, how about we discuss what we'll be covering today?
Absolutely, Bobby. Thank you very much. And thank you everyone for tuning in today. So today we're going to talk about your retiree healthcare benefits. And when we think about this, we think it's best to divvy these up into two buckets. The first bucket is your pre-age 65 benefits. This is before you're eligible for Medicare. So you will need to sign up for benefits that do not include Medicare until you turn 65. Of course, post 65, that's when Medicare kicks in. You sign up for Medicare and you begin receiving those benefits. So you've made the happy decision to retire from Verizon, but you're not yet 65 years old. What does this mean for your benefits? Let's find out. Okay, so you'll be happy to know that if you are fully retirement eligible, and we'll talk more about that in a couple of minutes, but if you are fully retirement eligible, the medical and dental benefits that you have in retirement are identical to the choices you had as an active Verizon employee. And we think that's a thought that's comfortable for most, that you have the same benefits when you retire as you did when you were working. On the vision side, through COBRA coverage, you will have the opportunity to sign up for 18 months with the Verizon Vision plan. The cost for that is $4 per month for an individual and $8 per month for a family. Vision, also, you may participate in the Davis Vision Advantage program. This is not an insurance plan, it's rather a network. And how it works is you present your card to participating vision service providers to receive a discount for services. Okay, back to the fully retirement eligible issue. We talked about this a few moments ago. Most of you probably heard of the rule of 75. And if you look at the second line on this slide, as an example, for an employee who's 50 years old, who has at least 25 years of service, those two numbers sum to 75, and therefore that person would be fully retirement eligible. An employee who's age 55, the years of service needed are 20, and so on down the line. One thing to keep in mind with this rule, you need to hit the minimums in each band in order to hit eligibility. For instance, for a 54-year-old who has 21 years of service, those two numbers do sum to 75, but the 25 years of service that is necessary as a minimum in that 50-year-old band was not met. So that person would not be fully retirement eligible. One other thing to keep in mind is for those of you that have 30 years of service, you are fully retirement eligible at any age. And again, just to review, full retirement eligibility means that you have access to the same healthcare benefits options as a retiree as you did when you were a full-time Verizon employee.
Great. Now let's talk a little bit about what spouses and child dependents can expect when the associate transitions from employment to retirement. And like the associates, spouses and dependents may be comforted to know that their coverage will remain identical. Their coverage options will remain identical when the associate was employed by Verizon as today when they are retired. And for the spouse, that means that they can continue to use the associate's retiree medical and dental coverage until they're age 65 and thus Medicare eligible. For the dependent child, that means that the medical coverage, that they can stay on the associate's medical coverage up until the age 26. When they do turn 26, their coverage will terminate on the first of the following month. In terms of dental coverage, the dependent child can maintain their dental coverage through the associate up until age 25, as long as they are a full-time student, be that undergraduate or graduate studies. If the dependent is no longer a full-time student before the age of 25, they will lose their dental coverage at that time, or they will lose their dental coverage at age 19 if that is when they are not a full-time student. So a very common question that we get is what happens to a spouse's or dependent's benefits if the retiree were to pass? And we'll divvy up that answer into your medical benefits and your dental benefits. First, with medical benefits, the spouse and the dependents are able to continue their same coverage, and Verizon will cover the bill for those monthly premiums for 12 months after the death of the Verizon retiree. And that will include prescriptions as well. And that coverage is actually the same for active employees too. Now, near the end of that 12-month period, Verizon will send a letter to the spouse or dependent letting them know that they will need to start paying for coverage as a surviving spouse or dependent. And they have a couple of different options at that point. Number one, they can continue using the same coverage, but they'll pay COBRA costs. And those costs will increase from the union negotiated costs that they were accustomed to paying. For pre-Medicare plans, that could be as much as $1,000 per month at today's levels. Or for the Medicare Advantage plan that had been negotiated by the union, the United Healthcare Plan, we'll speak to that in a little bit more in a few slides. That could be as much as $211 a month at this time. That's for your medical coverage. For dental coverage, your dental coverage will end at the end of the month in which the retiree passes, and the surviving spouse or dependent has the option at that time to enroll in COBRA coverage, and you can continue that coverage for 3 years. Okay, next let's speak to what you would do when you retire to elect your healthcare benefits. And electing your healthcare benefits is one of a couple of different components that you'll have to address at the time that you're retiring, assuming you're fully retirement eligible. In addition to electing healthcare benefits, you'll be electing your pension, be that your annuity or lump sum, and you'll have to address your 401k with Fidelity as well. What we want to say that if you're working with us, we'll help you navigate each one of those steps in the proper order and make sure that you're following the proper process for initiating your retirement. Having said that, as it relates to your healthcare benefits, there's a couple of different resources that you could use to elect those benefits, and they both relate to the Benefits Center. You can log on to the Benefits Connection online portal at verizon.com/benefits connection, or you can call the Benefits Center and speak with a retirement specialist. And we encourage you to do that. That's certainly part of our process when we help Verizon employees retire, is we call the Benefits Center. We want to speak with a retirement specialist. Not only will they be able to help us with your retiree healthcare elections, they'll also be able to help with your pension elections. And we think that is a good way to go about the process. Those Benefits Center representatives, those retiree specialists, are available during normal business hours, or of course, you can log on to your online portal at any time during the day as well. So when you go through that election process, the one key deadline that you'll want to make sure to cover is you want to make sure to elect your healthcare benefits before your retirement date. So it doesn't have to necessarily be the day that you call the benefits center to initiate retirement, but it needs to be before your retirement date. And assuming you do that, your employee benefits will continue until the last day of the month that the employee retires in. So let's say you retire on April 15th, your employee benefits will continue until the last day of April. Your retiree healthcare coverage would begin on the first day of the following month, in this example, May 1st. One point of that tends to be a point of confusion that we want to point out to you is that Verizon is required to send all employees a letter immediately after retirement explaining COBRA. That doesn't mean that you are paying COBRA costs. That does not mean that you haven't elected your retiree healthcare benefits. That's something that Verizon is required to do by law. So don't let that confuse you when you receive that letter in the mail after your retirement.
Awesome, Bobby. So let's take a deeper dive into the medical coverage options that you will have as a Verizon pre-age 65 retiree. Again, remember, if you're fully retirement eligible, they will be the same as the choices you had when you were a full-time employee. And those choices are listed here on the screen. There are 4 of them: the Blue Cross Blue Shield Anthem plan, the Managed Care Network plan, the PPO, and the HMO. So again, the choices are the same, but the costs may differ versus what you had as an active employee. Now, the Blue Cross Blue Shield Anthem plan is under contract through the end of the year 2026. The terms are going to remain the same through that date. The cost of the other 3 plans will change year to year based on market rates. Okay, so you're weighing your retiree medical coverage options. How should you go about doing that? Well, we have a shorthand saying here that a good way to think about that is to consider the 4 C's. And the C's are listed here on this slide. The first one is coverage. Among the options you're considering, what are the coverages? What are the limitations to those coverages? How do those coverages compare to what you have today? Is your coverage today sufficient? Do you need to change to something else? Speaking of change, number 2C, how will your lifestyle change, if at all, in retirement? For instance, will you be traveling more? This may mean that you may consider a different medical insurance option. The third C is conditions or special medical conditions. Do you or anyone in your family have any special medical conditions that might require, say, an out-of-network specialist, for instance? This may tilt you towards considering a certain type of medical insurance in retirement. Last but not least, of course, we should weigh the cost, the last C, the cost of each medical option. We think that these considerations should be addressed before you retire, at least 6 to 12 months before you retire, to give you ample time to plan and consider all the options and carefully consult experts and get advice on the direction that you should go in. You should not wait until the eve of your retirement to do this. You should begin it as part of the retirement planning process at least 6 months prior to retirement. Okay, here's again some resources that you can consult as you ponder your medical insurance options. First one, of course, is the Verizon Benefits Center, accessible through the phone number during normal business hours to connect with a Verizon benefit specialist, or the online portal 24/7. The second source is perhaps one that's not as well known. It's a gentleman by the name of Tom Ballack. He is a full-time CWA retiree benefits specialist. He's an expert at your Verizon retiree benefits. He is very approachable, very easy to talk to. We consult with him all the time, and we've learned a lot from him. We would encourage you to reach out to him if you have any particular or unique questions about your Verizon retiree benefits.
Wonderful. Okay, so the first part of the presentation related to your pre-65 benefits. And so now we'd like to take some time to discuss your post-65 benefits, and that would be Medicare. So we'd like to start by talking about when and how to enroll, what those deadlines for enrollment are. And those deadlines will look a little bit different given the circumstances that you're in. And so we'll start with the first enrollment period and here, and that's the initial enrollment period. And that centers around that 65th birthday that many of us associate with Medicare. And that 7-month enrollment window starts in the 3 months prior to your 65th birth month, the month that you turn 65, and then the 3 months after your 65th birth month. And during that period, you can enroll in Medicare, original Medicare A and B, Parts A and B, as well as the Medicare Advantage Plan, Part C, and Part D prescription coverage as well during that period of time. If you miss the initial enrollment period and you don't qualify for the special enrollment period, then you can register for Medicare Parts A and B during what's known as the general enrollment period. And that's at the beginning of each year from January 1st through March 31st. And something to note, if you do miss the initial enrollment period and have to enroll in Medicare A and B during the general enrollment period, penalties may apply and you may have to pay higher premiums for your medical coverage. Okay, next is the special enrollment period that we just alluded to. And that special enrollment period states that you're allowed to join Medicare or make changes to your coverage based on certain life events, qualifying life events that may occur. And here are a couple of examples of those qualifying life events. One example is moving outside of a planned service area. You would qualify for a special enrollment period of several months. Loss of current coverage because you've retired from your employer or were otherwise terminated by your employer. New coverage being made available to you if you were, let's say, to be hired by another large employer after the age of 65. Changes in your health plan, changes in your eligibility, all of these would be considered life events that would qualify you for a several-month special enrollment period. Finally, the annual enrollment period allows you to make changes to your healthcare coverage or prescription coverage. And that annual enrollment period is October 15th through December 7th each year. And so many of us associate age 65 with Medicare, rightfully so. But a common myth is that everybody needs to enroll in Medicare at age 65. And that's actually not the case. So we'd like to discuss a couple of different scenarios in which you would have to and wouldn't have to enroll at age 65. And we use examples that we commonly see when working with Verizon employees and their families. So the first example for who would need to enroll at age 65 is those who are fully retired and have not yet elected Social Security. You would have to actually go through the manual process yourself to enroll in at least Medicare Parts A and B, and then you can choose if you want to engage with the other parts of Medicare as well. Anybody who retires from Verizon or another large employer, but is still working for a small employer or somebody who may be self-employed would have to enroll in Medicare at age 65 as well. So if you're, something we commonly say, if you're a Verizon employee who is self-employed in retirement, running their own lawn care business as an example, or if you go to work for another small employer for a period of time that has fewer than 20 employees, even though you're still working, you would have to physically enroll in Medicare yourself. Okay, so let's talk a little bit about who would not need to go through that physical enrollment process at age 65. Anybody who is still working for a large employer defined by the law as any employer with more than 20 employees, 20 or more employees, does not need to enroll in Medicare yet. They would only do so when they retire from that company or leave that company. So if you're a Verizon employee who is still working at Verizon after the age of 65, you would not need to enroll only when you retire. If you leave Verizon and work for another large company, you do not need to enroll. You only need to enroll when you retire. This third example is interesting. Those who are fully retired already before the age of 65 and have already elected Social Security. Social Security will automatically enroll you in Medicare Parts A and B when you turn 65. So this is not to say that you wouldn't be enrolled in Medicare. It's to say that the Social Security Administration is going to automatically do the enrollment for Parts A and B for you. Now, in addition to that, if you wanted to buy a Medicare Advantage plan or enroll in Part D prescription coverage or purchase a Medigap policy, well, then the onus is on you to do that when you turn 65 as well. But in terms of signing up for enrolling for original Medicare, you do not have to do that. The Social Security Administration will automatically do that for you. When it is time for you to enroll, there's a few different ways you can do that. You can call the Medicare phone number at the bottom left-hand side of the screen here. You can apply online at ssa.gov/Medicare/signup, or you could go to a local Social Security office and schedule an appointment during normal business hours as well.
So let's take a look at the components of Medicare. What makes up Medicare? So original Medicare, which is the government provided Medicare that most of us think of when we hear that term, is composed of two parts. Part A, which is inpatient hospital coverage, and Part B, which is doctor's visits and similar types of care. Part C is actually not connected to original Medicare at all. Part C is provided by private insurance companies, and Part C is made up of Medicare Advantage plans. Part D is prescription coverage, and there are also supplement plans called Medigap plans that are meant to fill in the gaps, the cost gaps, like copays and deductibles that you incur as part of your Part B coverage. Okay, let's take a deeper dive into Medicare Part A. Again, this is original Medicare, US government provided insurance. The coverage for Part A is for inpatient hospital care and similar services like skilled nursing facilities, home health care, and hospice care. There are no monthly premiums for most people for Medicare Part A, but there is a deductible, and that deductible is $1,600 during 2023. And there are copays as well, and they may vary based on factors, including the length of healthcare services.
Perfect. Okay, let's move on to the second component of original Medicare, and that's Medicare Part B. And whereas Medicare Part A covers inpatient care, Medicare Part B covers outpatient care. And that includes items such as doctor's visits, mental health services, home health care, therapy services, costs for durable medical equipment, including wheelchairs, walkers, blood sugar tests, many preventative services such as wellness visits, screenings, and vaccines. Unlike Medicare Part A, where there are no monthly premiums, there are monthly premiums for Medicare Part B, and those start at $164.90 here in 2023. And it's possible they could be higher for you if you have a higher modified adjusted gross income. In addition to monthly premiums, there's a deductible of $226 in 2023, meaning the first $226 of Part B type expenses, medical expenses that you incur, will be owed by you. And after those first $226, Medicare will typically pay 80% of the costs, and you will pay 20% of the costs.
Okay, so we just covered Medicare Part A and Part B. Again, that's government provided insurance. It's called original Medicare. Now let's move on to Medicare Part C. And this is something completely different. This is private insurance company plans, and they are intended to be an alternative to Medicare Parts A and B. They are not in addition to, they are an alternative. You would do one or the other. They are bundled plans, normally including Parts A, Parts B, and prescriptions, which is Part D. Some plans also have basic vision, hearing, and dental services. These tend to be comprehensive plans where the coverage is pretty broad, it's pretty good. And in fact, the CWA has negotiated a plan with United Healthcare that is offered to Verizon retirees, post-65 retirees as part of the benefit suite. And the terms of this plan are good through 2026. The costs are fairly low as when compared to general marketplace Medicare Advantage plans. There is no premium cost, and the maximum annual out-of-pocket cost is $1,050. Now, if you're going to shop around for a Medicare Advantage plan outside of the United Healthcare plan, we would encourage you to be careful and make sure you're comparing the plans apples to apples. For instance, there are other plans in the marketplace that have no premium, no monthly premiums. However, it would be good to understand what the annual out-of-pocket cost is for those plans and how those costs compare to the United Healthcare plan.
Okay, next is Medicare Part D, and Medicare Part D covers outpatient prescription drug coverage. And there's a couple of ways that you could purchase a Part D plan. Number one, it can be added as a bolt-on to your original Medicare Parts A and B, or another way is it could be bundled within a Medicare Advantage plan as well. And there's a wide array of Part D prescription plans available, a wide array of coverage options, and thus a wide array of costs. So it's important as you're shopping for a Part D prescription plan to really review those plans and make sure that you're purchasing the right amount of coverage for you.
Okay, so let's say you signed up for original Medicare Part A and Part B, but you're a little uncomfortable with the potential out-of-pocket cost that you may incur with original Medicare. What you might do is consider a Medicare supplement insurance policy, or Medigap policy, as it's also known. This policy will help pay for some of the remaining costs of covered services in original Medicare, like co-payments, co-insurance, and deductibles. There is a premium that needs to be paid for a Medigap policy. And this is in addition to the Part B premium that you will pay as a part of original Medicare. One good thing about Medigap policies is that there's usually no in or out of network restrictions. There is an open enrollment period during which you should purchase your Medigap policy if you would like to do so. If you wait until this period closes, then you're going to encounter some restrictions. You may not be able to get a Medigap policy after your open enrollment period closes, or you may have to buy it at a higher cost. As always, you should understand your coverage options, and the website medicare.gov/plan-compare is a good resource for general description of Medigap policies. And finally, we have some more resources for you to consult. The first one is directly to Medicare. There's an 800 phone number, and the website ssa.gov/Medicare. This is a good resource to answer your general questions about Medicare. Again, of course, the Verizon Benefits Center, accessible during business hours via the phone number on the screen, or accessible 24/7 at the online portal. And this is a good resource for a general description of your Verizon Retiree healthcare benefits. Tom Ballack from the CWA, he is an excellent resource. He is an expert in your benefits. He can answer your hard questions. He can help you weigh the options of your retiree medical coverages. We encourage you to reach out to him for advice and to answer your questions. Last but not least, at H&A, we do have qualified Medicare consultants in our network, and we will put you in touch with them if you want to have a conversation with a very knowledgeable resource about your Medicare options.
Wonderful. And as we conclude here today, we just want to take another moment to emphasize the importance of addressing your retiree healthcare options and thinking about that in the broader context of your retirement planning. That can be really important. It's important to make sure that these options that you choose are aligned with your vision for retirement. For example, one of the considerations that Bernie mentioned earlier is whether or not you plan on doing a lot of travel in retirement. If you're doing a lot of travel in retirement, that could impact the plan that you end up choosing, both pre-65 and post-65 as well. So that's just one example of how it all works together. And that's why we really encourage you to think about this in addition to your income planning that many of you are already focused on when it comes to planning for retirement. At least 6 months prior to retiring pre-65, preferably a year prior to retiring pre-65, we think it's a great idea to really think about your pre-65 benefits. At least 6 months, preferably a year before you turn 65 or will otherwise be eligible for Medicare. To enroll in Medicare, we think it's a good idea to start having that conversation and thinking about what the right healthcare coverage would be for you. You know, we covered a wide array of topics today at a very high level. And I'm sure there are a lot of more detailed and nuanced questions that you may have after listening to this. And so with that said, we're going to be reaching out to everybody that was on the webinar here tonight. If you have any other questions that might be more specific or nuanced or more personal to you, please feel free to call us. Or, you know, Bernie referenced many of the resources that are available to you to help get these questions answered. If you're not sure which resources are going to be best for you, give us a call and we'll help coordinate and make sure that you're getting the resources that you need to answer these questions. But with that said, we thank everybody for tuning in here tonight. We really appreciate your time here. And if anybody has any questions, we look forward to being of service here soon.
Thank you very much.